I'm Dr. Ioanna Nixon.
I am Dr. Vilma Podcast, and this is Open Doors Podcast, two women scientists driven by curiosity, evidence, and compassion.
Hello, everyone, and welcome again to Open Doors Podcast, where we explore professional well-being in oncology and beyond. One conversation at a time, conversations from the heart. And today's guest is someone who embodies that spirit of purpose, resilience, and bringing a global perspective.
Welcome. Dr. Jonathan Lim is a clinical senior lecturer and consultant medical oncologist specializing in advanced immunotherapy and cell therapy. He is based at the University of Manchester and the Christie NHS Foundation Trust. He's also a key voice in medical education and professional well-being through the European Society of Medical Oncology. He is an active member of the ESMO Resilience Task Force and ESMO Faculty of Translational Research. Welcome.
Thank you very much. And thank you very much for the very kind introduction and for having me here. Very happy to chat today.
And John, you also happen to be originally from Brunei and you moved abroad. You moved to the UK for your medical training and career. I think I can describe you as being very passionate about lifestyle, traveling. I don't know about cooking. Maybe I can ask you about that. We want to talk today about a topic that is, I think it matters a lot, about moving abroad, moving for career purposes. How did you find opening doors, metaphorically and literally, for yourself and for others?
Yeah, thank you for doing the homework. I think not many of us, or not many in the field, maybe know that I'm from Brunei, because Brunei is such a small country. It's a tiny country in the northwest of the Borneo Island with a population of about 450,000 people. And so actually, when I first moved to the UK, it's not really by choice in some ways because we don't have a medical school back home. So many of us who want to pursue medicine as a career, we do have to seek for opportunities abroad. And because in some ways, because of the history of Brunei, the UK was a natural flow to pursue medical school. And that's how I came here a long time ago now. So I first moved to the UK in 2008. And of course, Ioanna, like you said, many people in the process, and I'm very happy to talk about them today, that kind of who opened doors for me and kind of mentored me and showed me opportunities. Before coming to the UK at that time, I've never stepped a foot in Europe. So going beyond Asia was a big step. We've seen it on TV when I was young. But it's really having people who have taken that steps and showing me that it's possible and dreams can be achieved, even when you see them on TV initially. I think those are pivotal moments at a very young age, right?
Wow, that shift was probably very big for you at that moment. When you decide to study medicine, go abroad, I have the same experience. I am from Panama. I did come earlier in an early age. I was 12 years old. But it is true that, as Ioanna was saying, you can feel the difference. And it is true that with the years, you can find it like maybe you miss home a bit more. And John, how was your beginnings? What was your emotional challenge at that time?
Yeah. It's a really interesting thing. And I think many of us who did medicine were so passionate about our ambition. So I think we were driven to really achieve what we want to do, and certainly to do med school required that drive. And I think that really kept me going for many years, I think. But when you reflect back and those intricate moments when you first move abroad, it's a huge step. And sometimes we underestimate the part of leaving your family behind who has supported you all throughout your childhood. But not just that. And for me, it's all my kind of school friends and close friends who are my support circle. So it's almost that you're transplanting, your whole life out of your normal comfort zone for the pursuit of, the hopefully a noble cause of becoming a doctor. And for me, it was that kind of drive and perhaps the resilience of really wanting to achieve and becoming a doctor was a big motivation to keep me going. But I wouldn't underestimate the kind of challenge of adapting to a new culture. And of course, Brunei is in the Southeast Asian cultural perspective. From a cultural perspective, is very Asian, right? So I think, that itself is quite a big change to adapt to the European lifestyle, new way of thinking, different political system, different food, different weather. So there are many adjustments that happen at that time.
Thanks, John. And I completely resonate, although my story is slightly different to yours. I am from Greece. I moved to the UK and actually expecting my first child. So many changes and landing into yes, cultural differences. And I still remember one of the first week that I was here and starting a new job and having to adapt to all of that. The TV was on. Picture this in your head. There was Nigella show. She was cooking in a Greek island. And I remember me, as soon as I saw this, I burst into tears and I could not stop. And obviously, yes, there were hormonal changes happening in my body, but it wasn't just that. And reflecting on that, it was all the things that I feared of that I would be missing while being in a different country, away from family, my parents, friends, network. But reality is that there are people along the way that hold your hand and open a door to friendship. And this is how you build a new network and you thrive and you develop a new home.
Yeah, I think for me, there were two big components. I think one was that actually from Brunei, we have a twinning program with a medical school in London. So we had done 3 years in Brunei and then 3 years in London to complete the clinical years. So within that, we have a program director who has been out to Brunei every year, teaching and lectures and stuff, and therefore serve as almost like a mentor. So he was really pivotal to make us comfortable landing in London and just a kind of familiar face to want to somebody who really wants to see us succeed in medical school. Because, I went from a small class of 15 of us to a class of 300 medical students, which was a big change. But of course, the second part of it are the kind of new friends you made. And I remember when I first came, in my third year of medical school here, I was really engaged in sports. So I played tennis, for example, and I joined the tennis team at St. George's, University of London, where I did my clinical years. And that really kind of allowed me to learn a bit of the culture and also meet friends through kind of mutual interest. And I think a lot of it is built from there. And through a lot of the friends who actually either from the UK or from different countries really bond. And I think that helps adjust myself to a different kind of lifestyle, almost a new life in parallel to home.
Yes, John. And what you're saying is very relevant for professional well-being, because the emotional dislocation for all those medical professionals or want to be students can be very, very overwhelming. There's actually a study that looked at cultural adjustment and well-being among international medical professionals. And what the study highlighted was that there was common emotional dislocation. So all that you're telling us was very important for future people who also want to study abroad or live abroad. Also thinking that now you are doing that for others. You are mentoring students, you are mentoring junior doctors or friends, and I'm very proud of everything you do for medical students, John. You're very enthusiastic about medical education and mentoring students. So, there's always something behind that. Tell us a bit more about your mentor role.
My mentor role. I think a lot of it probably came from my background, coming from a country where, we are such a community. I come from a family where my mom's one of 9, my dad is one of 9. So it's a huge kind of a family spirit. And I myself have 3 other siblings and I'm the eldest in the family. So I think I've always had that kind of family vibe going on with making sure that everyone around me are happy. And I think when people around me are happy doing what they're doing, it makes me happy too. And I think a lot of it perhaps was an intrinsic trait that I have that maybe I wasn't aware of. And I think for me, going to work is supposed to be fun and enjoyable, despite the stresses. As an oncologist, we experience a lot of emotional distress and, work burden. And I think the more that you have of people enjoying what they do around you, it really drives me. So I think a lot of what I do is probably not something I think as of a task, but more so sort of my way of building my community around me. That's why I'm so passionate about kind of mentoring the next generation of oncologists per se. In my role, I also teach medical students and take them on projects, supervise different things. And I see that as just part of my life more than the job itself.
Yeah. Do you have a story of someone you've mentored and you really saw them grow that you can share with us today, John?
Yeah, I think there's quite a few of them. Perhaps, one good example is when I was even a junior doctor, when I was not a consultant yet. They in the UK, our training program is quite a long one, and many of us, when we are middle grade trainee doctors, advise first year doctors, and I think that's probably a time when you're fresh out of medical school and you may not know a lot of ways of doing things. So it was perhaps this particular kind of first year doctor that I was mentoring when I was a junior at that time, and kind of seeing how this person was very enthusiastic and engaged in doing what she wanted to achieve in her career, and just showing little things like, for example, how to conduct an audit, or how to take something from an idea to a kind of research paper, and seeing how this person just get empowered by just little things, like which seemingly easy in those of us who are experienced doing it, and then you giving that platform to then bounce and then just run with it and fly. And I think there's nothing more satisfying, as even when I was a junior doctor, to see somebody more younger than me by a few years doing that. And I think that's what keeps me going with my role now as looking after a fellowship program and kind of mentoring a group of different colleagues and students. I think I think mentoring and supervision is probably a gift that keeps giving. I think that's something that when you round back in terms of the field of resilience, it's probably something that keeps me going when seeing people succeed and happy doing what they're doing.
And contributing to all that is as you said, is really satisfying.
Yeah.
It gives you a lot of joy.
Yeah, completely. And I think it's also saying, ultimately what we also care about our patients and also the community. And I think, if you are mentoring somebody just because you're showing them that this is something that's done before and just giving some shortcuts, then they get to where they want to get faster and easier. And in some ways, they also do better for our patients and what they choose to even specialize or subspecialize in going forward.
That goes both ways. Anything that you've learned from someone younger in the area that you could perhaps share and that was really helpful at a different stage in your career? So you being more senior and someone being more junior.
Yeah, that's a really interesting question. Um, I think sometimes it's more sort of, for me, appreciating my achievements. I think, speaking to a lot of more junior colleagues, especially now where I am, I think I don't realize sometimes what I've done because you get busy doing different projects, doing different things, and and sometimes we're guilty of moving from one thing to the next. We don't stop and celebrate as much or think that a certain thing is an achievement. And I think many of my more junior colleagues sometimes remind me that actually you've done something great, and maybe kind of enjoy that moment and celebrate a little bit. And I think, it becomes a bit more of a reflective time to think about that. And I think that's a really nice thing to actually be able to enjoy achievements and successes.
Yes, John. And when we want to pursue our dreams and go after them and be our best selves, as you said before, in the clinic with our patients and our colleagues. But it is true that sometimes pursuing the career is difficult and we have to take many decisions day-to-day basis, not just at the clinic, like every day we make choices, and that starts when we're really young, when we're students. I remember when I was a medical student, my dream was going to Sweden. I've always wanted to do an Erasmus there, and when I had put the papers in the university, I had everything set up. The University of Barcelona called me and they said, no, you cannot go there. You don't know Swedish. The first thing was like, then why do you offer this? And then I was really, sad because it was part of my dream at that moment. Now I realize, and I can imagine this scenario for a fellowship program outside your hometown or moving to another country as you did, John, and another continent. So I want to ask you, what could you say to a young international doctor who's struggling right now to find their own new place?
Wow, that's a strong question, actually. I think personally, I am a believer that if you really want to do something, you just have to go and do it. And sometimes by speaking to others, especially colleagues, doesn't necessarily need to be somebody very senior and doesn't necessarily need to be somebody who you're working with. writing to kind of colleagues that you meet in conferences and various places. There are ways to get certain things done. And I think if you really believe in something, I think there's a way almost to get there. Of course, at the same time, I'm also a believer that sometimes things happen for many reasons. And if something that you really want doesn't work out, and this is probably a conversation about navigating failures and barriers. Perhaps, sometimes it's about thinking differently and thinking about what else could be there and kind of taking a step at a time and kind of move on from that and look at opportunities that may come later. And not taking it too hard, that really affects, what you really want to do in the bigger picture point of view. So I don't think I've really answered your question in that sense, but in a way, what I think is really just kind of share the burden of what you're experiencing with, people or people you have contact with. And sometimes people can give you advice that may allow you to navigate just the next step. And maybe that can open more ideas to what you want to do.
Vilma and I touched on that before. It's around self-compassion in a way, John, and self-awareness, sharing a problem or sharing a struggle and seeking out for help, support, somebody who might have been there and knows more and can advise is really important and can actually be of help. The other thing I wanted to add to this point is that we do have evidence in the literature that actually there was a review that looked at burnout in foreign trained medical professionals, and it found that emotional distress was higher and there was a need for better structured support. So I think probably in the way of supporting resilience, there needs to be a more structured approach to people who travel abroad to work there.
Yeah.
So talking about burnout, John and I met a couple of years ago. We're very highly dedicated to professional well-being, and we met Ioanna this year at the ESMO Resilience Task Force workshop. For us, professional well-being is very important, and we want to ask you, John, because you're part of the ESMO Resilience Task Force, what are we learning nowadays about burnout in oncology?
Yeah, big question, Wilma. And I think the fact that the three of us are together speaking really shows the power of global network and, forces or vision that unites people. And I think that's really nice. And I have been part of the ESMO Resilience Task Force really since the inception of the task force at the end of 2019. So it's been a bit more than 5 years now. And actually, the way it was set up initially was that Professor Banerjee, who's a medical oncology consultant at the Marsden, was studying kind of burnout among the young oncologists in Europe. What her original study found was that, about 7 in 10 young oncologists can be at risk of burnout in Europe. That was really shocking when it first came out in the Annals of Oncology. That really stimulated a group of people who really care about this cause to come together, think about solutions necessary to tackle this. And of course, what happened was that after the task force was formed, COVID happened, and it really kind of shook up the ambitions of their task force. But collectively, we were a group of people caring about this cause. What we thought was it was an opportune moment to really understand in the event of such a crisis that really affects the world, what can we learn about oncology and burnout in oncology specifically? And therefore we went to do that. So in the past 5 years, we've done a lot of surveys that was prospectively conducted. It was initially linked to COVID, but I think what we're beginning to do is adapt some of the learnings to be a broader form of learning. And what we know is that the issue of burnout is real and burnout is a problem and we cannot deny it anymore. And I think this is something that is important, particularly as evidence-based oncologists, that we really need data to show that a problem is a problem. But what we were able to also show that apart from it being a problem and that oncologists are particularly at risk of burnout is that there are risk factors that we can think about when we think about burnout. So we know young oncologists are particularly at risk, similar to previous data from the ESMO group. But also women or people with responsibilities at home has also increased risk of burnout. But also many things that really are occupational related. So the workload, the way we have shifts, the amount of stuff that kind of help us do our work is a huge thing. And I think, again, in the field of oncology, moves so fast. And that's really good for our patients and the way we really do cancer research and things. But at the same time, puts a lot of burden on, on many of us who are trying to do better for our patients. So we have to learn all the time and almost firefighting the workload we have. So as part of that, we have worked with occupational psychologists and really look at kind of job resources versus demands. And that's really a model that really still fit within the oncology setting, that when there's ultimately, if there's an imbalance between resources available versus demands, then you really have a problem. And that's probably one of the biggest conclusion from it. And probably a plug here that we have summarized a lot of that work in a recommendations piece that was published in ESMO Open last year, really looking into what solutions we can take as a society going forward, both from a kind of organizational perspective, but more sort of a day-to-day perspective as well.
Yes, John, congratulations to you all and all the team for the great work you're doing for professional well-being. Here in Spain, we have done 2 surveys as well, led by Dr. Ellis from Lebanon Hospital. And our findings were pretty much the same. We published them in ESMO Open. We saw burnout rates among oncologists that were consistently high. And yet so often we just push through. So it is true that what you're doing with ESMO is very important and hopefully will improve things as we see them now.
Yes, and we are very thankful to a lot of people who participated in this in a very stressful time in their lives. The survey had more than 3,000 participants from more than 100 countries. So we really hope that it gives a global picture for many people out there who maybe have their voices heard, per se, in the work that we are just representing. And I think it's really a team effort to just put it out there that this is a problem, because it's an important starting point. And many of this work is now represented from a policy perspective, which is how we hope will start bringing the momentum of change. And I think sometimes we require that kind of initial head start to make that bigger change going forward.
Absolutely. A more tape question to you, John, because your work is really important in early phase trials. And given the nature of these trials and the patients that are recruited, that can be emotionally challenging for a number of reasons. So how do you navigate that, and where do you find your own resilience within that space?
Perhaps I can summarize that in that sense of purpose. And I think, for me, whenever I kind of live life, I really appreciate having that sense of purpose. For me, is a two-edged thing. One is more sort of that I'm a geek inside, and I really believe in cancer research and the idea that we're doing everything we can do to advance the field so that, there's wider benefit from people who come after. And I think being part of very early phase trial, we may be opening doors to kind of effective medications going forward. But the other patient-facing front is that actually many of the patients who come to us have no other treatment options left. Sometimes, and some people may criticize me for saying this, but sometimes in early phase trial, we are a little bit like a glamorized palliative care team, because we are kind of giving opportunity to look after patients in a very rigorous way. And a lot of my patients appreciate those very close follow-up. We know them very well. We see them every week, and we give them a little bit of hope. And with that little bit of hope, some patients even get good benefit. And I think that drives me and my team. And seeing the patient being looked after in a very vulnerable time in their life it gives me an extra edge of being an oncologist in that sense. So I think ultimately for me, it's more sort of doing something I'm really passionate about and that I see a purpose in it that really gives me that resilience.
Thanks, John. Yeah, it's a calling, in other words, because you mentioned about this big purpose and your
Yeah.
Yes, and it's true that when we take patients to phase 1 clinical trials, it's a moment of uncertainty. And it is true that when we take it from hope, it's important because it's an option of treatment that could really work. So I believe that this is very helpful for patients as well. And previously you were talking about how we're shifting oncology now with burnout and professional well-being and all the emotional load we have during our work. We wanted to ask you if you can make one systemic change in how oncology supports its professionals, what would that be, John?
Wow, big question. Again, I think I'll preface that by saying that there's no one solution that fits everything. And I think there's also a lot of cultural nuances that's different between different countries and different populations. From my perspective, the most important perhaps are the people. And I think if systems invest in people and having enough people to do the work that they love doing, I think that is a good start. And good workforce planning is particularly important in many teams. Whether it's a well-resourced healthcare system or an under-resourced healthcare system, having enough people and good people doing the work will make a big difference.
Few quick fire reflections. What is a quote that keeps you going and perhaps may help myself, Vilma, and others who listen?
Whoa. Interesting, actually, because when I was a kid, I kept a diary of quotes. So it's something I really like doing. And something that has been kind of in me for many years is a Mahatma Gandhi quote, which is that if I get it right, is that happiness is when what you think, what you say, and what you do are in harmony. And I think that's been something that resonated with me for a long time.
Thanks for sharing.
And John, what do you miss most about home?
The people. I think, family and friends. You can only do so much in phone conversations. There's nothing quite the same, being physically around people. And we have very close families where I grew up, and, we have very strong circle of friends. And I try to go back every year, but this is probably something I miss most about home, amongst other things, including food.
And finally, John, who is the next person you hope to open a door for? Have a think.
Probably my clinical fellow. I am in a privileged position now where I'm a consultant, I'm a senior lecturer, so clinical academic with my own kind of tenure track position. I'm very keen to support the next generation. And we have clinical fellows that come in our team under my direct supervision, and very, very happy to kind of open doors for opportunities. And see them shine and see them rise to new challenges and new opportunities and do good for the world.
John, they are very lucky to have you. Before we close, we'd love to give you the last word. What's one reflection or message you'd like to leave to our listeners, especially those who might be walking their own path, far from home, trying to stay resilient in medicine and in life?
I would say be kind to yourself and be kind to others. And I think if you remember that, a lot of the self-compassion comes with that. And when times are hard, just allow yourself to take a break and be gentle with yourself. Life happens, challenges will be thrown at you. And as long as you have good family and friends around you and have that strong self-belief and self-compassion, I think you'll go far.
Jonathan, thank you for sharing not just your science, but your heart. This was such a meaningful conversation. You've shown us that professional strength and personal vulnerability can and should coexist.
Well, thank you very much for having me. I've really enjoyed sharing my personal insights and also, professional life too.
Thank you, John. It was wonderful having you. And to our listeners, keep opening doors for yourself and for others. This is Dr. Ioanna Nixon.
I am Dr. Vilma Pacheco-Barcia from Open Doors Podcast.
And remember, you belong in the room.
You belong in the room.